The difficult moments in clinical practice are not always the obvious ones. Sometimes the patient still turns up, they nod, they still say, yeah, that makes sense, and they still tell you they understand the plan, but then nothing really changes. They don't ask questions, they don't seem engaged, they stop questioning the plan. They become more passive in the process. As clinicians, we notice that because engagement tells us something. The difficult question is, what does that actually mean? Have they lost trust in us? Have they lost confidence in the plan? Are they starting to question whether this approach is right for them? Or is there something else going on? Because in the clinic, we often notice change before we understand that change. And that is where the real clinical reasoning starts. Major point number 1, do not confuse a change in behavior with an explanation. I used to think that if we paid enough attention, we should eventually be able to work out what's happening. Clinical reasoning trains us to look for explanations. So when a patient's behavior changes, we start trying to work out why. Maybe they no longer believe in the plan we've created together. Maybe they're questioning whether physiotherapy is actually what they need. Maybe they're comparing our advice with what their buddy told them. Maybe they've discovered AI, oh my AI. Maybe their frustration isn't with me or physio, maybe it's the whole medical system. All of those explanations are possible. And importantly, the change itself matters. The patient asking fewer questions, becoming less engaged, or appearing less confident is the information. That change deserves attention. The mistake is not noticing the change. The mistake is assuming we always know what's going on with our patients. Because behavior is part of the clinical picture, but behavior is not the diagnosis, it's a signal. Our role is not to ignore the signal, our role is to understand what it might represent. Major point number 2, stop guessing, return to the shared plan. Eventually, the clinical reasoning has to become practical. Instead of spending all our energy trying to decode every change in behavior, we need to come back to the fundamentals. What are we actually trying to achieve here in physio? What is the functional goal? Does the patient understand what we're trying to do? And more importantly, do they actually want the same outcome? Because rehab only works if they're pulling in the same direction. If they understand the plan and they're on board, great, keep moving forward. But if not, that's not failure, that's information. Now it's time to find out what's getting in the way. Ask, listen, don't guess. Maybe they're worried they'll make something worse. Maybe life has simply gotten in the way. Maybe they're hoping for something completely different. Whatever it is, you won't figure it out by filling in the blanks yourself. Sometimes the answer is better communication. Sometimes the plan needs changing. Sometimes your goals and the patient's goals simply don't line up. And occasionally you realize another clinician may be a better fit. That's okay too. Our job isn't to convince people. It's to offer the best care we can, work with the patient where we can, and know when it's time for them to find a different path. Major point number 3, the uncomfortable truth. Sometimes you can still do everything right and still not get patient buy-in. This is probably one of the hardest lessons for developing clinicians. Sometimes you listen carefully, you communicate clearly, you adjust the plan, you address their concerns, you explain everything reasonably, and the patient still does not engage the way you hoped. That can be difficult because naturally we want to be clear in our explanations. We want to know, what did I miss? What should I have done differently? Why is this not working? But in clinical practice, it does not always give you a satisfying answer. People are complicated. Pain, fear, previous healthcare experiences, expectations of passive or hands-on care, the costs of treatment, and many other factors influence how someone responds to care. Sometimes there is a clear answer, and sometimes not. The important shift is this: a patient's lack of buy-in does not automatically mean you failed. It means you've reached the limit of what you can control. Clinical reasoning is not about getting rid of all uncertainty. It's about making the best decisions possible with the information available. Bonus point: what does a good clinician do when trust is uncertain? A good clinician does not chase approval. They do not become defensive. They do not keep pushing a plan just because they believe it is right. But they also don't immediately assume the relationship is beyond repair. They stay within their scope of practice. They continue to reason clinically. They communicate clearly. They focus on function. They offer an active plan they can genuinely believe is appropriate for this patient right now. And then they initiate the patient into that process. If concerns exist, then explore them. If If the plan needs adjusting, then adjust it. If another professional opinion or pathway is more appropriate, then recognize that. Because the goal is not to make every patient agree with you. The goal is to make sure that the care we provide is thoughtful, appropriate, and understood, and as aligned as possible with what matters to the patient. That is what professionalism looks like. We are not going to win every patient. Not every person will trust your plan. Not every person will agree with your recommendations, and that's okay. Our responsibility is not to control the patient's response. Our responsibility is to reason well, communicate clearly, and act professionally and provide the best care we can with the information that we have. Those are the kinds of lessons I wish somebody had shared with me when I was starting out. That's why I'm making these videos. My 2 books are now available at Amazon. What They Don't Teach You About Documentation in Physiotherapy School, a short how-to manual for successful daily note templates, and From Injury to Recovery Through Exercise, simple functional exercise progressions for physiotherapists to restore lifting, standing, walking. Thank you for your support.
It's time for another video, and this one will make you smile and unlock a world of timely updates by subscribing to my channel. Thank you.